Welcome back, everybody that joined the first session. And if you're joining us for the first time, welcome to the latest iteration of what we're calling the Edinburgh Futures Conversations. So this is the University of Edinburgh hosting important conversations with convening experts from around the world to help us to understand important topics which are dominating everyone's thinking. And what greater example is there at the moment than the COVID-19 pandemic? So without further ado, I'm just going to introduce the speakers and contributor for the next session, which is entitled Health Governance and Pandemic Determinants. The first person I want to introduce is Chelsea Clinton. Chelsea is here as a global health advocate, and we had been hoping to welcome the Clinton Global Federation in person to Edinburgh actually last year, but that was, like many things, blown off course by the pandemic. But we will at some time have Chelsea here, I hope, physically in Edinburgh. Her father is an honorary degree recipient of the University of Edinburgh, so there's already a family connection there. But Chelsea, you're very welcome. Thank you for giving up your time to join us. We have Professor Felicia Knaul, Director of the Institute for Advanced Study of the Americas at the University of Miami. So Felicia, likewise, welcome to Edinburgh, and we're sorry that you're not here in person, but we will get you here sometime. And thank you for joining us today electronically. And then we have two of my own colleagues here, Professor Devi Sridhar, who is Chair of Global Public Health here at the University of Edinburgh, and Professor Liz Grant, who's the Assistant Principal for Global Health. And Liz is going to facilitate the session. So with that, Liz, I'm going to pass over to you. Thank you, everybody, for joining us.
Thank you, Peter, and thank you, Felicia, Chelsea and Devi. It's excellent to have this panel. You know, in the last session, Dr. Fauci mentioned the last great pandemic, the flu pandemic of 1918, 1920. And I'm reminded of a poem that was written during that time by W.B. Yeats, a Celtic Irish poet, The Second Coming. And there's a line in it that's so familiar. And he says, "Things fall apart, the center cannot hold." And I want to ask each of you, how have things fallen apart from your perspectives? How are you seeing the world falling apart? Felicia, if I come to you first of all.
Liz, it's such a pleasure to be with you. I wish we were in person, but to be together virtually and share around the world. I want to thank you for all that you do for global health. Your heart is always in everything. We've worked on palliative care so many times together. And so we at the University of Miami, and speaking also from Mexico, from Tomatelo, we are so pleased to be part of this. Let me say a little bit from the Latin America perspective, which is where my home and my heart is. And that is that things have completely fallen apart. We are looking at a region that is 8% of the world's population, yet between 25 and 30% of the accumulated deaths. Right? Countries like Mexico and Brazil that are not in the top 5 of population, yet are in the top 5, accounting again for accumulated deaths in our world. And we're seeing horrible patterns in places that we hold dear, like Colombia, like Peru. You know, what has fallen apart in some countries, what fell apart was national stewardship and national governance, where leaders that refuse and still refuse to wear masks, that walk around in public, that encourage primarily the poor who don't have access to PPE not to be able to protect themselves, despite the fact that they have to go out to work. Countries where informal sectors are huge, where we know that there isn't the kind of insurance we'd like. And let me also say countries that chose to take apart their health systems, like you would take the roof of a house, knowing that the hurricane was coming, knowing that a pandemic was coming. So we left them very, very exposed. Countries like Brazil and Mexico that chose to undertake what we've called punt politics, to basically dump and push onto state governments what national stewardship should have been doing. They should have had a stronger relationship to the World Health Organization, to the Pan American Health Organization, and they asked these 32 or 27 states, creating a kind of chaos, right? And then what we're seeing now, which has us tremendously worried across the region, are these scandals in the distribution of vaccines. We need to think about equity, but I'll just say, foreshadowing what I'm sure we're going to talk about, we have a syndemic here, a confluence of different pandemics. Richard Horton has written about this in The Lancet, and we need to get to those underlying causes of what happened.
Felicia. And Chelsea, can I bring you in this as well? Because I know you've been so concerned about the inequalities that are just so exposed by the pandemic.
Yeah, I mean, Liz, I was listening to Felicia talk about kind of the abrogation of national stewardship across Latin America. And, we previously had a president here in the United States who never even had a posture, really, of national stewardship. So there was no abrogation. There was just an absence of leadership when we so desperately needed it. But really kind of just thinking about kind of your question on inequalities, regardless of kind of what sector or facet of life we look at, kind of the pre-existing inequalities, kind of arguably the center was already not holding before COVID, have all just gotten so much worse, both here in the United States and globally. So, whether we think about gender equality, which I know is something incredibly close to all of our kind of hearts and life's work, that's been set back, 25 years, possibly longer. If we look at kind of the job losses here in the United States, particularly over the last few months, they have fallen disproportionately on women of color. If we think about kind of the education disruptions, almost all of the kind of more than 1.5 billion students in the world have had their schooling disrupted, but those disruptions have fallen most equally already on our most vulnerable. If we think about our incarcerated people here in the United States, where we have 5% of the world population and 25% of the world's incarcerated, almost all of kind of the 20 largest clusters of COVID cases have been in incarcerated congregate settings in prisons and jails. And yet we still are not providing sufficient PPE or healthcare or kind of recognized humanity to incarcerated people. And most states still have not prioritized people who are incarcerated to receive the COVID-19 vaccines that are now available. And so whatever kind of facet of our society, whatever kind of slice we want to take from a sector perspective or a demographic perspective, the kind of preceding inequalities and inequities that existed before COVID-19 have been worsened, and our responses have not had equity kind of at the center of them to try to ameliorate that worsening or to try to actually kind of manifest the Build Back Better ethos that we hear now kind of very much is this kind of summoning national rhetoric, but we don't yet have operationalized at a federal, state, or local level. So I think we just have so much work to do here at home and globally.
And as you say, those inequalities, they were there. They've just been exposed and more overexposed and overexposed again. I'm going to ask Devi to come in on this as well, and then we'll circle back again. Devi, for you, what are the areas you're concerned about most?
Yeah, and also just thank you for having me here. And it's such a pleasure to be here on an all-women's panel with Chelsea, who I've been working with for years, a dear friend who's been such a champion in the United States of trying to kind of bring attention to these inequalities, as well as to Felicia, who's been working in bringing attention to cancer and at my alma mater, University of Miami, and enjoying sunshine back home. I think now it's exactly right. It's about those inequalities. And I think one of the good things is that people are finally paying attention to them in a way that they've actually been there for years. So right now, I think there's been a lot of debate around vaccinations. And is it correct that we're vaccinating, huge percentages, as we saw in the slides before, of richer countries before health workers and poorer countries? And COVAX, this facility is trying to rectify it. But in the end, we know it will always happen because it's happened in the past, that rich countries are going to steam ahead and poor countries will be left behind. And so it's interesting that now people are finally paying attention to it, where if you actually look in the past, we have an effective MMR vaccine, and still we have over 140 deaths per year, largely in children under the age of 5, preventable deaths because we don't give them vaccinations and we can't get them rolled out. So I hope in a way it has been a really rough year, but finally people are paying attention to public health, and maybe there's a chance to actually start to address these and start to say, why do we accept things the way they are, and how do we do better for the coming years? And realizing how connected we are. I think next time there's going to be an outbreak of plague in Madagascar or yellow fever in Brazil, people are going to pay attention. because actually not many people were paying attention to what was happening in Wuhan in early January. And I think countries really regret that, not actually realizing how connected our world is.
Thanks, Devi. And you've been saying that throughout the year, since last January, February, you've been highlighting that. You know, in this context, can I ask where the centre is? How would we hold our governments to account going forward? What needs to be done? Can I ask? Well, sorry, go ahead.
Liz, I was just going to say, you know, I think in some ways the answer is the complement to what Devi just said, that hopefully people now are paying attention more to public health. I mean, I was thinking, Devi, like you and I co-authored an op-ed. We wrote the first draft on February 4th of last year, and it took us almost 3 weeks, I think, to get kind of anyone to pay attention, because there was still throughout February this posture of like, what's happening in Wuhan is tragic for the people who are affected there, but that will never, come here. Whereas, of course, we know by February, COVID was already very much present here in the United States and becoming an increasing problem throughout Europe. And so I think, Liz, how do we hold governments to account is ensuring that kind of people not only continue to pay attention to public health concerns, understand why inequity and inequalities actually are fundamental public health concern, that we won't be kind of protected from COVID-19 until we all are protected from COVID-19 and all kind of vaccinated, but also to ensure that people are being informed with real science-based information from credible sources. We have to continue to put pressure on the social media platforms and our conventional media sources to not only not traffic in misinformation, but to report responsibly. So I've been thinking about this a lot here now in the context of the COVID-19 vaccines, where you'll see these headlines like, terrible tragedy, a man died after getting a COVID-19 vaccine, whereas, he'd had a pre-existing heart condition and he died because of his pre-existing heart condition. Like, there's no causality to the COVID-19 vaccine. So we have to, Liz, just continue to pressure the social media platforms to take down the misinformation, to deplatform those who are kind of purveying and profiting from the misinformation, and continually to put pressure on our traditional media companies to report responsibly on COVID-19 and other areas of public health concern. And I believe that if we are able to do that, people will hold our political leaders to account for either their failed leadership in this moment or their good stewardship in this moment.
Yes, you're so right. And there's an onus now, I think, on each of us, also an onus, to be honest, on universities, on places of knowledge, on agencies, to speak the truth. And Felicia, can I ask you in that context, because you talked about stewardship earlier and the need to be stewards of the knowledge we have, the technologies we have. How do you see holding the governments of South America to account, government of Mexico to account? How would you do this?
Absolutely. Let me also just mention, I can't hear Devi when she speaks, although I read and see and read you all the time, so I have a pretty good idea of what you're saying. But for whatever reason, I can't actually hear you. So if I repeat, forgive me on that one. Now, how do we hold governments to task? The first, and going back to the same point, we need data. If you don't test, and this has been true all over Latin America, if you don't test, you don't know. Now, the most recent data we have is we test in a very inequitable fashion. So tests are available for the rich, but not for the poor. Therefore, what it seems like is that the poor don't have as much COVID as others. The poor don't have as many of the diseases we are concerned about as the rich. And that's entirely false. It's where inequities in the way that we apply data and knowledge are going to inappropriately define the way that we undertake policy. And I think this is true very much on gender as well, and on any group that doesn't have voice. If you have women locked at home and unable to be able to speak, then you don't know what they're going through. I keep asking myself, is it really true that women die less than men of certain diseases, and particularly COVID. Well, if they never got to a health system, if they never got tested, and we never measured it, we don't have the right answer to that.
Yes. Okay, that's very powerful, and we need to know more, and we need to hear women's voices in a different way as well. I'm conscious that this session is actually quite a short session with brilliant thoughts, and I want to move us. We've been describing the issues, we've been describing this, the disintegration as well, the challenges of that. But I want to finish over the next few minutes to ask you a different question, a question wherein lies hope. Elif Shafik, in that wonderful book, Staying Sane in the Age of Division, said, we need to tell different stories. We inherit circumstances. We can improve them for the next generation. I would love to hear from each of you, what are the stories that we need to tell going forward? Can I ask, Devi, can I ask you first, what's the story we need to tell?
Well, I think there's two. There's one about science. I think the mRNA vaccines are incredibly exciting. We're already seeing them redeployed for malaria. We can get a malaria vaccine. We're going to save a lot of lives. So I think science has accelerated and delivered in a way that we just have never seen before. And I think the second is community. You know, when restrictions were brought in, most people, I wouldn't have thought we'd see the compliance that we have seen, at least across Europe. And I think the solidarity of people putting aside their interests, the majority of people, 80 to 90% of people for now over a year, is pretty astonishing, and actually looking out for each other. So we hear often in the papers about, you know, the house parties, the people breaching the rules. That's the exception. The bulk of people, even young people in the younger generation, have really looked out for older members of society. And I think that's a real testament to actually the goodness of humanity.
I'm so glad you mentioned the young people, because I agree with you. And I think the student communities, really across so many universities, across so many schools, primary schools, they have been outstanding in speaking out. I'm going to ask the same question to you, Felicia, as well. Wherein lies hope?
So I wanted to speak to three issues very quickly. One is, I think we have leapfrogged a decade or more in telemedicine, and that can increase access if it's appropriately used. And also, I think, you know, help us to get back on track with issues like gender equality, helping women and children to get easier access in less disruptive ways to their lives, to health systems, is really, really key. Second, the question is, I think, how can we change what's happened in having cyber spaces and virtual workspaces in a way that generates a better gender balance in the joy of being with one's family and caring for one's family, and also the opportunity to be able to have quality in the workforce. In other words, women and men being able to lead a more balanced life. And the last thing I wanted to say is, I've been thinking more and more about the idea of an economics of hope, that we cannot take our prices as given. We've seen over and over again, ARVs, the HPV vaccine. If we plan based on the prices of today, we will make all the wrong decisions. We have to hope and know that there can be a better future, primarily thinking of economics, because prices are permeable. We can get vaccines to people at lower prices, and that means more for more people in a more equitable way.
I love that, the economics of hope. And as you say, that's the work that you have been doing. And I know it's actually also work you've been doing in palliative care, looking at how to alleviate global suffering, as Richard Horton spoke about, that being the abyss of suffering that was almost unimaginable in the world that we had allowed today. Chelsea, can I come to you as well to ask you wherein lies hope?
Well, Liz, I want to answer this also briefly, but in a few ways. One, I think about what Jim Kim, who's one of the founders of Partners in Health, and then was the head of the World Bank, has consistently said that, optimism and hope are moral choices, right? I think we have to choose to be hopeful and optimistic, because otherwise, we might just want to pull the covers over our head. And I don't think that is a morally defensible choice at any moment, but especially not at this moment. And so I do think for those of us who care about the issues we've had the chance to talk about today, or those that we haven't, will choose to be optimistic and hopeful, because then kind of as Felicia said, we are not taking the status quo for granted. And clearly the status quo pre-COVID was itself unacceptable, and certainly kind of everything that we've discussed here today is unacceptable and I think immoral. And so it does give me tremendous hope that there are so many people kind of rushing into this space to reimagine our future, and with that, the tools that we need, like an economics of hope. Certainly everyone on this panel and in the panel preceding us gives me hope. My dear friend Devi gives me a tremendous amount of hope that she has withstood unimaginable abuse and cynicism and just continues to stand up for what she knows is right for her students, for your university community, for Scotland, and for our globe. And certainly I share kind of the hope that she finds in science and in our scientists. I also think we just have to acknowledge our frontline workers all over the world. Those who are giving vaccinations, whether here in New York City or with the newly arrived doses in Nigeria earlier today, or in the many countries that do have access to the vaccines, and hopefully the many more that will very soon have access to the vaccines. Really kind of for all the applause that we kind of give to our frontline workers, it will never be enough. And you deserve kind of the every accolade, but also every protection and recognition that we could ever imagine. So just a tremendous amount of gratitude for the work and also for the hope that you give every day.
I think that's a wonderful summary, as it were, as well, of coming from what we've heard in the first session and what we're hearing now, that there's so many people involved in being responsive to this pandemic, so many people who've held on to hope, who are telling stories. I'm so very conscious our time is short. I'm going to circle back actually to another Celtic poet, John O'Donoghue, and he said something: if you remain generous, time will come good. And you three have remained generous in your time. And I think you've remained generous in your insights into what can be done. You've talked about the stewardship and the economics of hope. You've talked about calling out inequalities. You've talked about trust and truth. And so for that, I want to say thank you for the time together. I'm going to call on Professor Peter Matheson now to come to reflect and to give a final word.
Thank you very much, Liz. We're over time, so I'm not going to bore anybody with my reflections, but yours will serve very well. It was a brilliant panel, and I think it was great to finish on a note of hope and optimism, because we have to, as Chelsea said, this is an absolute requirement, that we have to turn adversity into opportunity, and we have to learn the lessons so that we can do a better job both locally and globally in the future. And I think led by the brains of the kinds of people that we've got contributing to these sessions today, there is hope that we can do that. So I just really want to say thank you to Chelsea Clinton, to Professors Felicia, Knaul and Devi Sridhar, and to you, Liz, for moderating. Thank you to all the organisers. I think we're going to bring the session to a close at that point. The best conversations always run out of time, and so we're going to get you back for further conversations in the future. I threatened Dr. Fauci and Dr. Jong with an invitation in a year's time, which I hope might be a physical invitation rather than a digital one, but whatever format, we want these conversations to continue, and we want you all to come back and continue to contribute. So Liz, with that, I think you want to close the session, but thank you very much to those three panelists, and to you, Liz, for chairing, and to everybody for participating.
Thank you. And to our global audience who's watching, thank you for watching. And I ask, please use the hashtag and let us know your comments. Let us know what you think about our 6 speakers and the insights that they have given us so far. The hashtag Edinburgh Futures Conversation. And can I also ask you to do something in that hashtag? Why don't you also, as a global audience, recognise the generosity of people around about who have helped all of you, all of us, keep going in this time, who have really made the difference and actually give each of us personally and institutionally hope for the future. So I'll thank you and say, press on the leave for your the timeline, and make sure that you come back in to the next session, which is going to start in 6 minutes at 2:30.